Hello, hello. Welcome back. Welcome back to the podcast, everyone. Welcome back. So excited to be finishing up the year with these remaining podcast episodes. So make sure you guys stay tuned because I am having a podcast episode where I am doing an entire year in review for 2024. So I'm taking my top 10 most listened to episodes and creating one episode where I give you clips of each of those episodes. So make sure you stay tuned for that. That's probably going to drop here in a couple weeks. So, because I am going to finish recording for the year and take 2 weeks off before Christmas and for New Year's before I resume giving you some awesome fucking content. Okay. Because that's what I love to do. So, little housekeeping. So make sure you guys stay tuned for the rest of the episodes. I'm going to have some good content, some good bonus stuff, and the CT Educator is coming to YouTube. This has been highly requested by quite a few technologists as far as long form content. So, as per your request, it is coming in January of 2025, where the CT Educator podcast will be officially on YouTube. So I'm freaking excited about that. Just trying to get all the tech set up. So it's going to take me a little bit of time. So while my children are out of school and I have some time away from work, I can set all these things up where I am not, doing so much as far as teaching and, recording podcast episodes and doing content and things like that. So I'm going to kind of take a little break and get all those things up and running. But as always, if you are interested in being the go-to CT tech, you can come and get coached and learn from me for 6 months inside my community where I give you an entire course portal. I give you live trainings, live workshops, many, many helpful guides, PDF, ebook, this, that, the other. And I also workshop to get you registry ready. So if that's something you're interested in, make sure you check out the show notes, click the link, and come join my program. It's 6 months at $5,000, very affordable payment plans. So come get coached by me. Also, if you ever have an interesting CT story or anything interesting, my email is available in the show notes. You can send me an email. I get emails all the time about different kinds of requests and or podcast episodes or something that you would like to hear on the podcast. So make sure you send me an email or you can follow me on Instagram. My DMs are always open. Make sure you check out because I do post a lot of content. So check me out on Instagram. So let's get into today's episode, which I have yet to bring you another CT scan story. So this is from the popular series CT scan stories, because I also have another series called CT trauma stories, but we haven't talked about CT scan stories in quite some time. So upon thinking about my vault of the different types of exams that I've done over the 22 years I've been a technologist, there has been a case that I did 6 months ago that would be perfect for this episode. So this one is the ICU patient and the steak dinner. So I know that title might throw you off a little bit, but just hang on, buckle your seatbelt because it's going to get interesting. So like I said, this is a case that I did 6 months ago. It was more during, I think it was probably at the beginning of summer. So there was this patient that came down for a stat CT of his chest. He was being worked up because he was having open heart surgery the very next day. Okay. I think he was getting a quadruple bypass, if I'm correct. So the patient was in his 60s, so it was a male. He comes down, I tell him my name, I ask him his name, the patient identifiers, and I explain to him everything that we're going to do as far as the CT. I explained to him that it will take, 2 to 3 minutes. We're not going to give him any contrast. Exactly, I was positioning him, making sure that my ISO center and centering is perfect. I talk about it on every episode, you guys. Make sure you get your ISO center perfect, okay? So that's very important. So the patient takes a looks at me, and I ask him if he had any questions, and he looks at me and says, "Can I ask you something?" I said, "Sure." He says, "So are you married?" And I said, well, no, I'm divorced. And trust me, I get asked this by a lot of patients all the time. And it's nothing that I take offense to. Okay. I know some people might be offended. I'm not. I'm from Vegas. So I don't get offended. So, and then he says, hey, were you married? Are you married? I said, well, I'm divorced. And I've been divorced, for quite some time, for 5 years. The patient proceeds to ask me if I have any kids. I said, yes, I have 3 kids. Then he asked me how long I was married. So at this time, his nurse is kind of raising his eyebrows like, okay, why are you asking her all these questions? So I said, well, yes, I was married for 10 years and, just some things just don't work out, right? And then I asked him if he had any additional questions about the exam because we were going to get started. Well, the patient takes a look at me and he says, I think you're very beautiful. And I would love to take you out to a steak dinner as soon as I get out of the hospital and get the surgery. I cannot tell you how his nurse contained his composure. So, because he had a male nurse, he had to walk out of the CT room because he was dying of laughter. So, and I just kind of smiled. It's not the first time that a patient has hit on me in the 22 years I've been a technologist. And it certainly won't be the last. Okay. So I turned to him and I smiled because I was very flattered. And of course, I started turning all red considering I'm very, fair skinned. And I told him, I said, sir, this is very sweet of you. This is very kind. And I said, but I don't date patients. So he looks at me, he goes, oh, I think that's a stupid rule, and tried every trick in the book to convince me that, oh, he wasn't going to be a patient in the hospital very long, so it wouldn't count. Mind you, the patient's like in his late 60s. Okay. I'm in my late 40s. So there's a significant age gap here. And he says, these rules won't apply and it'll be okay. You should just let me take you out to a steak dinner. And so I thanked him and I said, listen, I think this gesture is very sweet. I am very flattered and you are very kind. However, I have stuck to the rule of I do not date patients that I take care of. And I don't even care if you get discharged out of the hospital or even if I took care of you and you were no longer a patient. I've stuck to that rule for the last 22 years. I've been a CT technologist and I've never broken that rule. Well, he was a little heartbroken, but I even stick to that rule when it comes to other coworkers in healthcare. And I mean, nurses, doctors, other techs. I've never dated any of them and I never will. So that doesn't mean that whatever works for somebody else works. That's just what doesn't work for me. So the patient tried to convince me on all the reasons why I should go out on a steak dinner with him. And I said, this is very sweet, but I have to politely decline. And so naturally, the patient, I get his scan done, and before he leaves my room, he's like, "Are you sure you won't change your mind?" I said, "No, sir. I'm sorry. I don't date patients." And he's like, "Well, it's probably because I'm in my late 60s." And I said, "Well, that has a little bit to do with it, considering that my dad, when he passed away, he was 56 years old." So go figure that. So he was a very, very kind patient. And I tend to get a lot of this, especially, when it comes to different patient populations, different age groups and things like that. It is not the first time that I've been hit on by a patient, and it certainly won't be the last. Okay. So, but I've always stuck to the rule that I do not date patients. And I know some people have, and it's different strokes for different folks. But I have a set of standards and rules for myself because I conduct myself as a professional and I want to maintain it that way. So that is my CT scan story of the year. Yes, because we are ending 2024 very, very soon. So this case is one of the most memorable cases that just threw me for a loop because he was so just adamant about the steak dinner that he made it so convincing that I couldn't refuse. But like I told him, I have a rule: I do not take patients. So, but that is my CT scan stories out of my vault because I have so many stories over the 22 years that I have collected that are just so interesting that you never forget. So, as always, make sure you guys share this episode with somebody that might enjoy this. Make sure you like, share, subscribe, give me a review, give me a follow on Instagram. Come join my coaching program because I will teach you the A through Z about being a good technologist and being the go to CT technologist. As always, thank you so much for listening to this episode and joining me on this episode. Thank you, and I will chat with you guys next week.